community established a very dynamic and resilient community with many ethnic grocery stores and restaurants and other businesses. However, from our experiences, we know that this community experiences a high level of food and nutritional insecurity, consumes less fruits and vegetables compared to local non-Somali population, and experiences disparities in health outcomes. So the Fruits and Vegetable Project consisted of two phases. The first phase, preparation for in-store intervention. And during that first phase of intervention, the owners and employees of the participating Somali grocery stores attended different workshops to help them to develop technical expertise to procure, store, and market fresh produce. And then also store owners were provided an opportunity to get connected with local farmers and growers and different food hubs to procure locally grown fruits and vegetables. Also, this grant allowed us to purchase refrigeration equipment for each store. And then that was a very helpful for the stores, because many store owners identified that they don't have the capacity, even though they would like to participate in the project, but they don't have that technical capacity to make that expansion or to bring fresh produce into their stores. So the being able to update the store infrastructure and specifically refrigeration system, it was very helpful. So in collaboration with the store owners, we developed different educational materials, and those materials were displayed in each store. And then also we work with the local Somali radio, so they also helped us to disseminate the information. During the second phase, the treatment stores, those who were recruited for the project, they introduced a selection of fresh produce. They offered at least 5 different kinds of fruits and vegetables every week for the duration of the project. And store owners, they received financial support from the project each week to procure fresh fruits and vegetables. They were expected to match the amount that was provided. So if they were about to buy fruits and vegetables from a local vendor for example, for $300, so we provided 150, and then they matched that amount. So as I said, so we collaborated with Somali radio and local Somali social media platforms, so to disseminate information about the project. So, and the community was well aware of the project, and we received very positive comments from the community members.
Thank you, Sardar. And so that project has sprung a lot of other projects, including this one that we're talking about in terms of the COVID vaccine education. And it really was a nice fit to have already built those relationships in the community, to be able to say, all right, well, this seems like another project that could really fit within the grocery stores. And it turns out, like Sardar said, we had 4 grocery store owners that were willing to serve as what we're calling vaccine ambassadors for the COVID-19 vaccine education. And so we contracted with Abdiaziz Odeye, and he became our our community liaison with the grocery store owners. And so, you know, of course, there's a lot of really important time-sensitive information that needs to be passed on. And so Abdiaziz really was that liaison between those of us in extension and those of us working with the Somali community. And so we provided the information in a timely manner to Abdiaziz, who then visited with the stores once a week approximately to provide them with the new information. And also we met with Abdiaziz on a regular basis to make sure that he had everything that he needed in order to serve the community. And so during the height of COVID, or yeah, probably in the middle the height of COVID, we started developing resources that were timely and also relevant to the Somali community. And so these are just some sample handouts that were available to the grocery stores to give to their customers or put into the customer bags or serve as kind of conversational springboards for people to talk about some of the new information that was coming out every week during the height of the COVID pandemic. And so one of the really important things that we needed to include were voices of people in the community. And so here you see two community leaders on the bottom who were good spokespeople for and promoting vaccine uptake. And also we did, these resources are in English, but we also had them translated into Somali for those individuals that prefer to read the Somali language. The other thing that was really important was this translation. And also we found out that pictures rather than cartoons were really important to include on the handouts rather than, the cartoons are not as real to people. So we really tried to include pictures of people and have that be as relevant as possible to the community. So this is one of the messages that we sent out to the community, focusing on young adults, because as we showed in the one of the first slides, that the Somali community is actually a very young community. So I just want to say too that if you have any questions and you want to just put them in the chat, or you can open up your mic and go ahead and just ask your questions, because it's a pretty small group today. So what were the results of our project? Approximately 500 people per store were reached each week. And we based that on just the customers that come in on a regular basis. There are 13 grocery stores in St. Cloud. And like all of us, we tend to have our favorite grocery store that we go to. And in this case, they have a lot of repeat customers coming to their stores. And so the owners really do get to know their customers. So approximately each store sees about 500 customers per week. Also, the XDig TV is actually a YouTube TV channel, and it reached a wide audience. There are about 1,700 subscribers. And really what we discovered through our evaluation was that there was an openness to having conversations. And we had planned to expand to 2 more stores and recruit youth ambassadors, but that unfortunately didn't happen, but it could still be something that would happen in the future, because we have these longstanding relationships with not only the grocery store owners, but some community leaders who can sort of serve as the liaisons between those of us in extension who have some of the great information to share, and then those in the community to help disperse that information. And I'm going to end with this slide, and I want Abdiaziz also to, if you would, to come back and comment on anything that you learned aside from these lessons. I sort of brainstormed some of the lessons that we learned. First of all, you have to go slow and not try to rush your project through. We understand and this was our issue, was the funding landscape was fast and furious, as well as the COVID-19 pandemic, of course. But the community doesn't go that fast. So we have to kind of roll with the community. So going slow is important. Keeping messages as simple as possible, because the information is so complex. really trying to figure out the best way to craft messages so people can understand and are willing to, uptake or take in the most accurate information possible. We learned that word of mouth is essential and it has to be accurate and timely. And that's why the Vaccine Ambassador Program is something that's replicated all across the country, even in the state of Minnesota with the COVID community connectors that the Minnesota Department of Health use across the state. Use specific social media outlets where people tend to go and trust. And I think we had really good connections in the community with those social media outlets. And go to where people are, like grocery stores and mosques in the case of the Somali community. What else did we learn, Serdar?
Well, yeah, I think this is pretty accurate. But I would like to add a comment emphasizing a great role of community liaison. Having Abdelaziz on this project, it was very instrumental. He helped us to develop what we call the culturally sensitive and appropriate information. So he provided feedback and input when we were developing the educational resources, and then the way how we should present, the way that how we should communicate the information. So he was really helpful there. So, and then also Abdelaziz was really helpful in terms of like being connected with store owners on a daily basis, because Abdelaziz was in the community almost every day, going through between those stores, asking them if they need additional flyers, and also collecting feedback from customers. So that was a really good it was a two-way project. So it wasn't only the information coming out from us, but we also were gathering suggestions, comments, and any input from customers, because customers, they like to talk, and then they like to express themselves. And this setting, grocery store setting, was the setting that was safe, and then where they were able to communicate the sensitive information with their the store owners, because many store owners, as Dr. Gold just mentioned, they have a loyal customers, right? So and this, they see these people every day, and this the grocery store in the Somali culture is not only just a shopping place; it's also a place where they socialize and exchange information and talk about different things, and just what's going on in the community. And being able to understand what concerns them most allowed us to tailor the information the way that it was more acceptable to present information. If they would like to know more about the boosters, if they would like to know more about the restrictions, or if they would like to know more about the testing sites. So that was kind of like and then this project was done in the during the pandemic. So I think this is people were overwhelmed, but the the strategies that were used and in the setting that was employed, I think, to help us to better understand how we can support the community. And another point that I would like to make is that even during the pandemic, where many businesses were closed, the stores were open, and people still were doing their grocery shopping. So I think providing the information where people where they don't need to make extra efforts to go somewhere to educate themselves, but because they are still still going in the grocery store to get their groceries. So and then the disseminating information at that place just makes it really convenient. So
Yeah, great. And thanks, Serdar. And I did post an answer to Maxine's question in the chat. And Maxine asked that, well, she said she liked this method, and how difficult or easy was it to build trust with the community? And so I think that there's kind of three elements to building that trust. And Number one is to show up and be present. Number two is to spend the time to build the trust. It's a long-term prospect. And number three, working with trusted individuals as champions, which is what we really tried to do with this project. And Serdar has really been successful at with his other projects that he talked about earlier in the presentation. So for the sake of time, because we have 4 minutes left, I'm gonna conclude and just thank everybody for spending their lunch hour with us. And if you need a certificate of participation, all you need to do is complete the webinar evaluation using the link that actually I'm going to email to you. And then if there are University of Minnesota employees here and you need well-being points, participants who register can attend the session live and you'll receive the recording. Both options are eligible to receive well-being points. So complete the webinar evaluation using the link that I'm going to send to you, and then request the well-being points. And then finally, that link that I'm going to send, it's a short webinar evaluation, and you'll be able to rewatch this webinar for up to 30 days after. And we also have a lot of great other webinars that are coming up, and you can find those listed on the website that's linked here on the page. So thank you everybody for attending today, and we have 3 minutes. So if there are any questions, let's try to answer your questions with the time that we have left, or comments. They don't have to be questions. And I'm going to stop sharing. So if you want to open up your mic and just ask a question, feel free. There's only 15 of us here. Well, if there are no more questions, I'll put our email addresses in the chat, and you can get a hold of us in through email if you have anything that comes up and you want to ask the question, or if you have any suggestions for us or any desire to collaborate with us. We always love new collaborators and partners in Extension. So this is what some of the work that we do, and so it would be great to hear from you.